Infections worldwide are rising. More than 16,000 cases of monkeypox have now been confirmed in nearly 75 countries, with over 1,400 from Africa. Now, while African researchers have been warning about monkeypox outbreaks for years, they are beginning to weigh in on the declaration of monkeypox as a public health emergency, calling for investment in testing and more surveillance as the dark continent is placed on high alert. Now, News Central's Omoniyi has more.
After monkeypox cases exploded last month in countries such as Portugal, Spain, and the United Kingdom, where outbreaks don't usually occur, a rapid global response followed, including distributions of vaccines in some countries. But monkeypox outbreaks have been occurring in parts of Central and West Africa for years. The situation is evolving, and the World Health Organization expects there will be more cases of monkeypox identified as surveillance expands in non-endemic countries.
Since the beginning of 2022, cases have been reported in Africa from Cameroon, the Central African Republic, the Republic of the Congo, the Democratic Republic of the Congo, Liberia, Nigeria, and Sierra Leone. WHO and partners are joining forces to urgently understand the magnitude and cause of the global outbreak.
The new modes of transmission are also a thing of concern, as monkeypox is primarily spread through close person-to-person contact and direct contact with sores and bodily fluids from infected people.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners.
Noting that monkeypox has been largely ignored by Western nations until now, and judging by the experience of vaccine inequality during the COVID-19 pandemic, African scientists call for increased surveillance and investment in testing.
If we have funds for future epidemic preparedness, we can then use it to respond to epidemics as they come. First and foremost, we need to train more epidemiologists. We need to train even the locals on the basic recognition of a disease that can be a problem.
So it's a cause of concern because now that means the disease is spreading in a different way. That scientists need to find out how it's spreading, how fast is it spreading, and will it maybe develop to be severe or it will remain mild as it is.
As Africa CDC, we have provided guidance to our member states on increasing surveillance for monkeypox, establishing laboratory diagnostic capacity so that it can be easily lab diagnosed.
Parts of Africa may well have built up some immunity to monkeypox, but equal access to effective vaccines is critical to protect the continent's particularly vulnerable populations, including health workers and the contacts of cases.
While there is no current treatment for monkeypox, the focus, however, is on transmission prevention before it becomes another pandemic like COVID-19. Niyi, Omoniyi, reporting for News Central.